We partnered with Surgical Science to design a learning model for robotic surgery setup. In this video, we'll cover a user scenario and our design solution that provides them easy access to a robot to practice on. Meet Danny. They recently completed their training in nursing and are set to join the urology department where robot-assisted surgery is frequently used. During nursing school, Danny learned about a few of the surgical robotic systems, like the Da Vinci Xi. Each robot is complex and costs millions of dollars, so Danny only had the opportunity to work with the robot once during their clinical. They will be expected to know how to set up a robot for surgery when they join the urology department. Danny is intimidated and nervous that they can't practice setting up the robot directly before their first robotic surgery with the team. Danny wants to be as prepared as possible for their first surgery with the robot. They want more ways to get hands-on practice so they don't slow down the team on their first day on the job. Danny's supervisor suggests practicing in a supplemental VR simulation app. The app provides a simulated operating room with problem-solving modules where Danny can practice interacting with a surgical robot at their own pace. The virtual reality app supports controllerless hand gestures, so Danny can better experience what it's like to use their own hands for each task. Danny knows they may be asked to do a number of key tasks depending on the needs of the team, and the app lets them practice these flexibly based on their experience level. The first task Danny selects is draping, covering the robot in plastic sheets to create a sterile barrier during surgery. They start with Learn mode, so they can be guided step by step to become familiar with the process. The app leverages the benefits of virtual reality to support tasks which demand an understanding of spatial awareness and 3D space. Danny finds that moving around in space with informative guide markers helps them have a better awareness of what they might expect in real life. Danny practices moving the arms apart and covering them in sterile plastic. After each module, they can see their progress and a final assessment on how they are doing. After learning several modules at their own pace, Danny wants to practice doing tasks without guidance. They select the practice mode for a module on driving and positioning the robot. In practice mode, Danny is assessed on the timeliness and accuracy of the task completion with minimal guided help to simulate a real operating room experience. In this module, Danny wants to challenge their skills in a realistic operating room environment with unforeseen variables such as noise, obstacles, or emergency situations. They first increase stress level from standard to low before starting the module. In this module, there is a simulated team environment with tasks such as driving the robot to the patient. During this task, Danny collaborates with a virtual teammate who gives them instructions to steer the robot to the patient. Coming out of the app, Danny has a general sense about what to expect for robotic surgery setup. They're informed on which skills they may need more practice on, have spatial awareness of maneuvering the robot in the operating room, and have practiced team collaboration. By getting immersive, hands-on experience through this learning model in virtual reality, Danny feels more prepared to be an effective member of their new team and are less intimidated about working on their first robotic surgery.